Hello class, this is Mrs. Alston and I'm talking about the cervical number 1 and the cervical number 2 anatomy. So the top part here is the C1, which is also known as the atlas. So as I bring this down here, you will note that the atlas has the anterior arch and the posterior arch. So the anterior arch is going to be right here. And then the very prominent portion of the anterior arch is the anterior tubercle. As you come around, you're going to have the articulating surface or the superior facet, which is going to articulate with the occipital bone of the skull, making the atlanto-occipital joint. You come back around here, that's the lamina, okay? And then back here is known as the posterior arch with the posterior tubercle right here. Now note that the atlas or C1 does not have the body and the arch like the typical vertebra, and that's because of the articulation with the occipital bone of the skull, and also the fact that the body of C1 actually forms onto the body of C2, creating the odontoid, which is right there. Now this is the transverse process of C1 right here with the transverse foramen, that opening. The opening here is going to be your vertebral foramen, which is going to allow the spinal cord to travel through. Now as I tilt this up here, you will see that this makes up the lateral mass. So this block of bone right here is known as the lateral mass of C1, and it's also the articular pillar on the other cervical spines. They just call it the lateral mass on C1. Now looking further down here, this is the body of C2 right here, and then there is the dens. This protrusion coming up through C1 is the dens or odontoid process. Then you have the transverse process of C2 right here, along with the transverse foramen. This is going to be the body of C2 right here, and there is the spinous process of C2. This is going to be your inferior articular process, which is going to articulate with the superior articular process of C3 to form the zygapophyseal joint. Now the joint that is going to be right here is known as the atlantoaxial joint space, because C1 is known as the atlas and C2 is known as the axis. So the atlantoaxial joint space, or the zygapophyseal joint space, is going to be right there, and that's the articulation between those two bones. So here you're going to have the superior articular process, and then down here where my thumb is going to be the inferior articular process, and that's what's going to articulate with C3. C2 also has the bifid tips on the end of the spinous process.